As you can see, I'm going to talk about epidemiology as well, but on a slightly more theoretical level than the previous talk, I think. As we all know by now, modeling has played an important role in the last couple of years in dealing with the COVID pandemic. And essentially, there are two general types of models, I think. The top-down type, that's the more traditional type, where you divide the population into compartments and then look at the ratio between those compartments with transition rates. Or the one that's more present in, or more fitting for this conference, the bottom-up approach, where you have agents that interact and transmit diseases between them. But most of the models that have been used so far, in the practical context at least, assumed that however complicated the system is, the pathogen essentially stays the same over time. And as we all know and have experienced firsthand, that's definitely not the case in reality. So this is the change in population composition of various SARS-CoV-2 variants over time. And yeah, we can see that the variants change quite rapidly. They have different properties, different infectivity, and so on. So evolution actually does do something in reality. And just to reinforce that point, these are results from a recent paper in Nature Communications, where they essentially took a very simple network model. So you have agents, they're all identical. They are simply connected by lines, by connections, so a simple graph. And they just assumed that the within-host evolution of infectivity leads to a normal distribution at the point of transmission. And when they do that, what they find is that as opposed to the usual behavior where the reproduction rate determines whether the pandemic spreads or dies out, you have this mutation-driven area. I don't know if you can see my mouse pointer over here, where even a suboptimal pathogen gets rescued by the mutation rate. So the lower reproduction rate gets increased by evolution, and then you get a pandemic phase, even though you would not expect that in a classical model. So the question now is, since this is an extremely simple model, what happens if we combine the behavior of complex behavior of agents and evolution in a single model? So is evolution relevant in this context? Do our predictions change? And more importantly, do the recommendations that we would make for policymakers change? And we tested that with a model. I have to say at this point, this is still a very conceptual model. So there are no, or basically no, real numbers in that model. So everything is still at a qualitative level, but that can be changed in the future. So the basic setup of a model is that we have a city that consists of buildings. Those can be residential, schools, offices, leisure centers. We have public transport, and agents always are present at any of these locations. So they are either at home or at school or in a public transport carriage, and that's where infection takes place. Agents have a certain amount of behavior, so they follow a daily schedule that differs between weekends and weekdays. They travel to work or school. They go to places of leisure. They have a certain amount of social connections. Those do not directly affect infection rates, though. They are simply for information sharing. So infection only happens in buildings or in public transport, but agents are aware of the infections happening within their social network. And the infections they experience themselves, or that their friends or family experience, increase their level of awareness, and that again leads to a higher cautiousness and might make them decide to, for example, stay at home. Then we have a certain level of compliance in agents. So there is a certain likelihood that agents do not follow the rules that are set by the policymakers. Now, on the evolution side, those are essentially two parts. First, we have the infectivity of the pathogen. We essentially assume that infectivity is determined by point mutations that can happen simultaneously and happen over several generations. Each point mutation changes the infectivity according to a simple normal distribution. And then at the end, all those get aggregated. And at the point of transmission, we draw with the weight being determined by the fitness. So it's a slightly skewed distribution at the point of transmission. On the other hand, we have the immunity. For that, we assume that each pathogen population has a set of antigens. Those are simple numbers between 1 and 100. And agents can react to those antigens by building antibodies. Those are 2 numbers, and the similarity between the antibodies and any window on that antigen determines the strength of the immune reaction. And that again determines recovery rates. So both of these properties get transmitted. So if a new host gets infected by a virus population, it gets a copy of the infectivity and the antigen set of antigens from the previous host. Now, the population reacts to this kind of situation by possibly implementing policies. That happens by simulating essentially a level of alertness or alarm in the government or local authority or whatever it is we're simulating. And so the number of symptomatic individuals in the population is monitored, and if it goes above a certain reaction threshold, then the alert level increases by a set amount. And if the alert level that develops over time, if the alert level breaks preset thresholds, then policies are implemented. So those can be wearing of masks, self-isolation for people who are symptomatic, and lockdown when nobody is allowed outside, basically. And as I said before, the amount or the degree to which people actually follow those rules is determined by their individual level of compliance. Now, what do we get out of this? First, in the very simple basic scenario, we assume that everybody just does as they are told. We defined a set of policies that can be relatively lax, average or strict. So those are essentially the levels of these thresholds that are determined by the type of policy. So a strict policy would increase the level of alertness relatively early, and also implement restrictions relatively early. And what we see in this scenario is that, and we also have different levels of cautiousness in the population. So people are voluntarily cautious in the sense that they stay at home when they are sick, and that can be either none, that's the blue dots, medium or high. And what we can see is that policy is quite effective in this scenario. So a strict policy actually leads to lower infection rates over time. Cautiousness does have an effect, but not very strongly. On the right-hand side, we see the proportion of infected individuals over time for medium cautiousness and an average policy. And we can see that equilibrium is reached relatively quickly and then doesn't change after that. Now, next we introduce non-compliance. So in this case, we assume that people in 10% of the time just do not follow whatever policy is implemented at the moment. In interestingly, that doesn't have much of an effect. So we still have relatively effective policies. Cautiousness has the same effect as well, and we still reached a pretty stable equilibrium relatively soon. All of that changes as soon as we assume that evolution happens. So if the pathogen actually evolves, all of a sudden we have much higher levels of infected individuals in the population. But on the positive side, policy is still quite effective. So a strict policy can prevent most of the negative effects of evolution. On the right-hand side, we can see that actually evolution leads to the appearance of new variants that then spread relatively quickly, but get caught by the implementation of policies. Now, the most interesting scenario is when we introduce evolution and at the same time assume that people do not necessarily follow the rules. This completely throws the entire system. So policy has essentially no effect at all. So in all cases, the proportion of infected individuals is much higher than in the baseline scenarios. Cautiousness does have an effect, but still, even for the strictest policy and with the highest cautiousness in the population, we still get pretty disastrous outcomes. And on the right-hand side, you can see that essentially the virus evolution is completely out of control. So we have really high levels of infected individuals. So those are the basic results. The next thing we tried, but that's a bit preliminary at this point, is to check what happens if we try to find the optimal policy for a given scenario. So what we did is we took the same simulation and then used an evolutionary algorithm to find the policy parameters with the lowest level of infected individuals after 1 year of simulation time. And here again, when we look at the base scenario, so this is now both settings, evolution and no evolution, on the left and the right-hand side in each panel, and full compliance and 90% compliance. So in this baseline scenario, we see that there's interestingly not much of an effect of neither evolution nor compliance. So the only area where actually anything interesting happens is up here, but that's the decrease of alertness. So the level of infected individuals at which the government actually starts to reduce its own level of alertness, and that we can assume that doesn't have much of an effect in reality. But that's of course unrealistic, the scenario we assumed first, since we assumed that interventions are completely free. So we assumed that policymakers can do whatever they want. As we know, that's not the case in reality. So as after a certain time, people get fed up with restrictions, we have economic effects and so on. So we have to assume that interventions carry a certain amount of material and political cost. And as soon as we introduce that, the picture changes again relatively strongly. So now all of a sudden we get interactions between evolution and no evolution. We get effects of compliance again, and in general the picture becomes much more complicated. Yeah, I think that's my results. To conclude, what we can see is that the evolution of the pathogen and human behavior and policy interventions interact strongly in some cases, and they interact non-linearly. So it's not easy to predict, given a certain intervention, what the effect is going to be if evolution takes place at the same time. And that means that predictions based on static pathogen behavior, as they are usually done in practice, can potentially be really quite wrong. We can also see that under slightly realistic assumptions, I mean, that's a very, very simple model at this point still, already best policies change as soon as evolution is assumed. So that means in practice that any kind of modeling that is used to support decision making has to take the evolution of whatever kind of pathogen there is into account. Thank you very much.